We are live, people. This is Average Joe coming to you this afternoon, Eastern Standard Time. I want to thank everybody for coming. Let me go ahead and just get on here. All right, so what we're going to talk about today, we're going to talk about back and hip issues and kind of where you think they're coming from. So let's go ahead and get started. So I'm going to bring good old Big Burford down here. I haven't quite named her yet. I'm not sure, or him, what you want me to name this old baby here. I guess I could just call it Magnus at this point. Hi, Walker family. How you doing? It's thanks for coming. Hopefully, hi Fox. Hopefully we'll get some more people in here so you guys can go ahead and exchange your guys' information. If you guys would love to, subscribe, that's awesome. Everybody that I've subscribed to, I try and see that at least between 4 and 5 minutes, and I've been trying to watch everybody's commercials so they can actually get some revenue out of this, since I know they work really hard at it. But so my discussion today is all about the back and the hip, and where's your pain coming from? There's two types of pain. There's radiating pain, and then there's radicular pain. And so a lot of times, even the medical professionals get confused between what's radicular and what's radiating pain. Now, radicular pain is basically something that's impinging on the nerve. All right, I'm gonna put little Scully aside here a second. I'm gonna bring little mini me up here. You can see the little nerves coming out of the spinal cord much better. But anywhere you're getting a pinch, whether it's in your neck, your mid back, or your low back, it pinches on those nerves and then it goes and shoots somewhere. Now, if it's in your neck, it's going down your arm, and if it's in your back or your hip area, it's going down your leg. Now, when we talk about the back and the hip, there's really three diagnostic tools that professionals have nowadays to really figure out where the heck their pain is actually coming from. Well, that's good. All right, so my boy here, Foxfire, that's cool. That's a cool name. I remember, anyways, there was a movie, and I remember Foxfire 1, Foxfire, where's that? That's from some movie a long time ago. Was that from Top Gun? I can't remember. Maybe you guys will be able to tell me. But anyway, so if you're waking up and going, the biggest problem, okay, so I'm going to just try and answer Foxfire here really quick, instead of going through all the basic anatomy and hopefully not boring you guys to death. But when you wake up in the morning and you're having, let's say you're just having low back symptoms, okay, you're not having any leg symptoms. So when you go to the doctor and you tell them, hey, I'm waking up with this pain, if we look at flags being green, you're okay, yellow is we're kind of cautious, and red meaning, uh-oh, we're in trouble. You're in the yellow range. And you're in the yellow range because this little red thing represents the disc. So if we kind of pull just one little segment off, or this is even better because it's much larger and you guys can see this. If we pull one little segment out, this is what we actually see. So you got your spinal cord on the back, you got your bone in the front, so it kind of looks something like this, and with the disc. The reality is this: if you're waking up in the morning, the disc is at its best height in the morning, and that's because you hopefully slept most of the night, and the disc filled back up with fluid, and so the space between all the little nerves in the back and the joint are at its greatest, and as the day goes on, it smushes back down again, and then you wake back up, you rinse and repeat. And so if you're waking up with leg pain or radiating pain down in the hip, that's a clear sign you need to see someone. Now, hi everybody. Oh, I got Caffeine Queen in here. Hello. And we got Being Real George. He says, watch and go on. Well, thank you, everybody. I know all you guys. Hi, Happy. But let me go on here. I'm just gonna kind of peek back and forth here to make sure that no one spams. But you guys are all awesome, so I assume that's not gonna happen. I don't want to get dinged, and obviously then I lose the live stream, excuse me, and so on and so forth. You guys know all that. But anyways, so when you wake up in the morning, that disc is at its Venus or at its apex or height, however you want to describe, fancy term you want to use it. And so, like I said, the radiating pain. Now you can get radiating pain right where my finger is in the joint space itself, and that's called your facet joint. I talked about that in the last live stream. Now, there's a couple different things, like I was saying earlier. They could do an injection. Now, the injection is not only for a treatment, but it's also for a diagnostic tool. They go in and they put some steroid, and they might put a lidocaine in there to kind of numb the area and give it a few days, let the area be bathed with that drug. And if your pain goes away, eureka, that's where your pain's coming from. If your pain's not coming from there, you might come in 3 or 4 weeks from now, go above and below that area and kind of pinpoint, exactly where that pain's coming from. So that's a diagnostic tool that they'll kind of, it's not only a treatment, but it's a diagnostic tool. Because a lot of times I'll hear patients say, oh, well, it didn't work, I didn't go back. So it's a physiatrist or a anesthesiologist that will do those injections. And people don't go back, and the reality is that doctor really needs to have that next appointment to really see if they hit their mark or not. And if they didn't, you need to go back and do that again. And so maybe the next time. Okay, so that's one technique they can do. Another technique is called nerve conduction velocity test. And essentially what they do is your speed of your nerves are on a certain speed. And so every nerve has a baseline speed level. And so we have that information. So we're going to put little needles, not too painful. Think of it like an acupuncture. It's very superficial. And they're going to put a signal, electrical signal, down through that nerve and see where it slows down and where it speeds up. Where it's slow, that's boom, they're going to target right there. So let's say you're getting the back and hip area. They're going to target your L5, which is this little vertebrae here, L meaning lumbar or 5. And then this little part down here, this big orange piece, is your sacrum or S. So a lot of people have an L5, S1 issue. And that a lot of times if you're an old guy like me, the joint itself starts to get arthritic. It's not really a disc problem as much as it is really inflammation. You've got the darn thing irritated, and you need to stop doing what you're doing, which a lot of times is too much prolonged sitting, or sitting like I call the letter C. I'm going to put a little mini-me here. I'll have her show you what you're not supposed to do. Your spine's not supposed to be a letter C. It's supposed to be a nice S. You have curves. The whole idea of having curves is because, think of a spring. It's a recoil mechanism. And so that recoil mechanism disperses the pressure through your entire spine. So let's say you land like that, or you get pushed quick, your spine is able to take that force through the entire joint. But if you're like a letter C, that's not so good. You're gonna hurt something somewhere. The force is gonna go somewhere really fast, and you're probably gonna either blow out a disc or cause a fracture somewhere. Let's see. Oh my! I got 6 people here. You guys are beautiful. Mwah. This is awesome. I'm thinking about, let me digress here a second before I go on further with the lower back pain in the morning, because there's a couple other things it could be. I do my videos on Wednesdays and Saturdays. I think what I'm gonna start doing is just doing my Wednesdays as live streams, and do my Saturdays as actually a video. The whole Scully spiel that I do that I hopefully you guys love, and I'm going to keep getting better at doing that. That's my ultimate goal, is to make not only this entertaining and humorous, but actually, information that you guys can go and use, and you can, you guys, whether it's your family members or you or your spouse or someone else. If you want to talk about little kid injuries or something like that, we can do that too. Or developmental issues with kids. I have some information. I've worked with kids, and so it's not only orthopedic and chronic back pain and stuff like that, or post-surgical. If you want me to talk about post-operative or pre-operative surgery type stuff, I can go over that. I think I'm going to bring a couple. I'm going to buy a model on the brain is, with some strokes as well as maybe some shoulders and knees. So I need to purchase a shoulder and I need to purchase a knee model so I can kind of give you guys a better visualization on that, because I'm an eye person. I got to see it to believe it. So anyways, let me go ahead and digress. Excuse me. Hi, Alex. Alex Reviews, thank you so much all for coming. You guys are beautiful. And so, all right, so let's say that you're, it's not a disc problem. So I was describing to you, when you wake up in the morning and you're still having pain, it's kind of a disc problem. Let's say that you might have, now I don't know your history, and obviously it's probably not appropriate to ask, but I'm just going to give a couple scenarios out there, and hopefully one of them will hit on point with you. Let's say that you, as a child, were never diagnosed with a scoliosis. Now, that's very easy. All they do, all those beautiful nurses do in the schools is they go ahead and just, all right, bend over and touch your toes. And all they're measuring here is the little bumps on the back side. And so they're looking for any type of mild rotation, that one bump is offline to the other. And then those, this child might have a scoliosis. So you could easily have been missed. And so let's say that you have a mild scoliosis in that lower part of your spine. And when it's scoliosis, kind of a tilt to one side, and obviously your body comes up, and so your head stays straight. Otherwise, you'd be tilted to the side. So technically, when you have a scoliosis, you have two curves to your spine. But let's just go ahead and say that you have a little bit of a scoliosis. Now, that being the case, that's going to put a lot more stress on that joint. And so lying on your stomach wouldn't be good, especially so if you're falling asleep in the middle of the night and you're on your stomach, not a smart thing to do. I think I have on one of my, either my stenosis, some of my videos that I did right off the bat. Obviously, I was new at this, and my old stuff has great content, but I'll be honest, it was garbage. When it comes to visualizations and entertainment, it was just kind of getting that information out there. So bear with those older ones, but the stenosis one might be a decent one for you. It goes over different sleeping positions with pillows and stuff like that you can put yourself in, that might reduce your overall pain, and so you're not going to wake up in the morning. If you're doing a lot of prolonged sitting for hours at a time, if you're in a recliner chair, soft sofa, and you look like a letter C, you're down like that, that's a lot of stress at those last two segments. And if you have any inflammation in there, I call it picking at the scab. When you pick at a scab, it won't heal. It'll keep going on and on. That's how the inflammatory process is. If you keep that inflammatory process going, it's going to keep going. Whether you take ibuprofen, Advil, any other type of non-steroidal anti-inflammatory, all right, the drug will kind of kick in, will work for a few hours, but if you don't change what you're doing, once the drug wears off, it's going to start right back up again, and you're like, this isn't working at all. So be mindful if you're doing any prolonged sitting at all. I have like a 30-second delay, so that way I can look back and forth, but maybe I'll go ahead and make no delay next time. I know a lot of times you guys don't do a delay, but I did a delay just so I could keep the content flowing. But what's your guys' thoughts on that? Let's see how I sound. Yeah. Do you guys have any questions for me right now? Otherwise, I'm going to keep going on the back and the hip issue. All right, I'll look at the chat in a second, but I don't want you guys to be bored. Try not to, anyways. I know your time is precious, and I absolutely appreciate you guys coming to watch me in my second live stream. But so let's just say that you're getting pain down into the side of the hip area, all right, and then it might come into the groin. That still might be coming from your lower back. Now, that's true, it could be coming from the hip too, but I would bet 9 times out of 10 it's probably coming from your lower spine area. Now, there's a few muscles that go from the hip to the spine that get irritated a lot. One is called your quadratus lumborum, or called QL for short. And also there's another one that crosses the front. It's called your hip muscle or your hip flexor muscle. That's a 2-joint muscle. A lot of times that can get irritated too if you're doing a lot of sitting, because when you're in a sitting position, that muscle runs all the way down the side. One of the muscle bellies sits in your hip. The other one literally attaches to the spine. Those two muscle bellies meet up and become one main tendon. They wrap in front of your groin and wrap and attach on the back side of your femur or hip bone. And so obviously it allows your hip to go up and down. It also allows you to go forwards. And so it's very easy. If you're a runner, if you do a lot of prolonged sitting, because we're creators, or we're doing a lot of content and stuff like that, we're sitting a lot, that area can get very irritated. An easy stretch with that would be just your hip flexor stretch, where you're either sitting in a chair and you're kind of coming into this direction to kind of stretch that area out. But hi, Mr. Florenta? Yeah, I'm like Gore. I'm going to destroy names if they're too complicated for my little brain. But like I was saying, these two muscle groups, the one in the front and the one in the back, they kind of play tug of war with one another. One's pulling one way, while this other huge muscle, this quadratus lumborum, a QL, we'll call it for short, kind of runs from this angle, this oblique side angle into the hip. And so they can start fighting with each other when you're doing a lot of sitting into a letter C. Because when you're sitting like a letter C, this muscle group is shortened and this muscle group is over elongated or over lengthened. And then that can give you a lot of rotational and joint pain. And so just looking at you, forget the disc, look at the muscle belly issues, whether something's too tight or something's too short. That's one main one that happens. Now, I did a video probably a couple weeks ago, I think it was on multifidus, which is a huge muscle that sits inside your lower spine and attaches into your sacrum, which is this orange bone here. That muscle, when you strain your back a lot, that actually shrinks, and you can actually get fatty tissue in there. I think I talked about this in my last live stream. It's pretty significant because you don't want fatty tissue in your muscles. The muscles don't work if you have fatty tissue there. I'm not talking about fat over the top. I'm talking about fat in the muscle belly itself. That's really scary. And so once that starts to happen, you don't do some of the things that either your therapist or your doctor or myself is talking about, the joint's going to take a lot more stress. It's going to get easy for it to be inflamed, and then you get into that inflammatory process in and out of it, and you don't seem to be getting any better. You might be better for a week or two, and then it comes right back. It's not all about, yeah, that's right, loads of sitting creating videos. I know all about that, especially being a young creator like myself. I'm learning. I literally am learning as I go. This isn't something you learn in school, at least not for me anyways. I didn't go into computer science or anything like that. Obviously, I'm a physical therapist. Everybody's always asking me, do I have a doctorate degree or am I a doctor? Yes, I have a doctorate degree in physical therapy. Could I call myself a doctor? I guess so, like a chiropractor calls himself a doctor. But I don't. I think it confuses the public. People, wearing a white coat with a stethoscope, and you're not an MD, you're not a physician. I think it confuses the public. I think you're personally, this is just me off my soapbox. I think you're trying to put off on something that you're really not. I think you should just love your profession like it is and do what you can for the people. And I've helped over the 20-some years I've been a therapist. I've helped thousands of people, and I hope to now bridge the gap between the waters and help everybody overseas, as well as obviously, in the continental U.S., Canada, Mexico, and the Puerto Rican islands and all that stuff too. So I really love to help as best as I can, and I hope to continue doing that. So I thank you guys for everything that you guys are doing for me and coming to see this. But anybody have any questions, Alex? We're all ears, Joe. Okay, thanks, Foxfire. That's sweet of you. Okay, and so we talked about apostolic disc. We talked about the whole C sitting thing that can cause these muscle imbalances. The other thing I see all the time on the internet is called the piriformis. Now, I did a video probably, geez, 5 weeks ago or something like. It's been a while. It was on piriformis or hip pain. It actually did pretty good. It's actually one of my videos. Like I think I got like 400 and some views, and that's before I even try to come out and promote myself and and promote others. I realized making good content, making good videos is like just the sliver. If I don't promote myself and promote others with me, I'm not going anywhere on this platform. And so I want to try and help as many people. Obviously, I want to make a few dollars, but trust me, 1,000 views. What's it like? 50 cents for 1,000 views. Trust me, we're not going to make a lot of money unless you're some fancy YouTuber, out there. But needless to say, we all got to start at. What someone told me, we all start at zero. So I digressed. But anyways, I did this on piriformis syndrome, and you'll see all types of catchphrases out there. One on, don't stretch the thing, don't strengthen the thing. What the heck is going on with this muscle, and does it really affect your hip so much? And oh, I'm not a chiropractor. I'm a physical therapist. Yeah. It's 7.5 years. It's a clinical doctorate program. It has a whole research component to it. So you do a research project or a research thesis. I always think us physical therapists are better than chiropractors. Of course, chiropractors would think the same thing, about themselves. I think there's a place for both. I think, obviously, if we looked at chiropractic versus physical therapy, chiropractic's been out there longer, but they've had issues over the last, let's say, 15 or 20 years with new science, new research, new diagnostic tools. Their old philosophies were proven wrong with the new technologies. They were talking about all this. We do a spinal manipulation and it can cure. I'm gonna be sarcastic. It cures cancer. And so the philosophy of chiropractic has had to change. I don't know a lot about it, but I did work for 1 year ago in Maryland, and very nice people. It just didn't work out. That old philosophy is different now. You have some new chiropractors that are more. They have what's called physical therapy techniques. So they'll do some of the same stuff, which muddies the water, gets people confused. You have some that do X-rays and just do X-rays and manipulations like that. You have some that are just homeopathic. They do a lot of vitamins and herbs and stuff like that. And so chiropractic has had to change through the years because a lot of insurance companies have basically said, look, we're not paying for none of this stuff anymore. So they've had to change, and you will see that if you go to a chiropractor and you say exactly what I just said to them, hopefully they'll be truthful enough. Or you can just go on the internet and type in chiropractic and the philosophy changes, So bar not, there are differences. Oh, yeah. Don't forget to hit the thumbs up. I haven't said that once yet. Now, I got 8 people, and I only got a few thumbs up. Now, don't get me wrong. Maybe I suck at this. I hope not. But I have a question. All right, Crazy Shepherd. All right, Crazy Shepherd, what's your question? And from now on, I'm going to make my live stream not 30 seconds because that's too much of a delay, and I want to be able to give you guys the information as soon as I can possibly see it on my phone. So I apologize. This will be the last time that I do a 30-second delay because it's too confusing, and I know people want to get onto the content and they want to hear what they want to hear. So go ahead, Crazy. Anyways, so while I finally get Crazy's information, I'll go ahead and go on to piriformis syndrome. Anyways, so piriformis is basically the main muscle that allows your leg to kind of rotate outwards, or what we call external rotation. There's a couple other muscle groups within the hip that also does that, but that's the main one. And that runs from underneath your sacrum and literally comes and wraps around and attaches to this side. And so that muscle actually crosses your sciatic nerve. So this, my finger, let me go get some color bands or see if I can find color bands so you guys have a better view. 1 second. All right, I'm back. All right, what's Fox say? Why does my mom's leg shake when she stands for 5 minutes? You're going to have to give me more information on that. That could be a lot of different things. So once I'm done with showing you what the piriformis is and stuff, I'll try and answer that question. This will only take a few seconds. And so let's just say that, so this bone right here on either side, which is your pelvis, this is called your sciatic notch. That's how big your sciatic nerve is. It needs that giant notch in the backside of our hip so that nerve can come through. And so let's just say that this red thing represents the sciatic nerve, and it comes down, runs into your leg, and splits off, and it's called a couple different things as it splits. But now that we're going to represent this green thing as your piriformis muscle. Now, in some people, the piriformis actually develops at the top of the nerve. Some people, it develops at the bottom of the nerve. All right, we're not cookie cuts. Everybody's a little bit different. And I said this last time. I think I'm going to do a video on the differences in just people and how, depending on just genetics, how people develop. Some people have a tendon, like an extra tendon in the hand. Some people have extra discs in their back. It's pretty interesting. So yeah, not everybody's a cookie cut. So there's definitely some abnormalities in humans. Hi, Proud. Hi, Barn. Thanks for coming. Thanks for coming, all. Love. All right, so let me get back to the piriformis. And so if for some reason you're one of these lucky people, I think it's like 2 or 3%. It's not a lot, but you figure with 7 billion people, 2% is a lot of people on 7 billion people on the planet. It actually splits. And so the muscle actually splits the nerve. And so you're dealing with a muscle split by the nerve. And so if that muscle gets inflamed or irritated, it pinches down, goes into spasm, and pinches on that sciatic nerve, and your sciatic nerve can go numb or make that whole leg numb and make it weak. And so that's a huge thing. What do you want to normally do? You want to normally lie on your side and ice it, because in this position on your side, it's in a nice shortened position. Do you want to stretch it? You want to gentle stretch it only if it's not giving you pain down your leg. You want to hold for 30 seconds to a minute. Why do I always say 30 seconds to a minute? I'm not, who came up with this minute thing? I'll tell you who came up with this minute thing. It has to do with the muscles. The muscles themselves have the maximum elongation at about a minute. So that's the reason why people come up with this 30 seconds or 10-second hold. It's actually, if you can sustain a nice gentle stretch for up to a minute, you're at the maximum length of the muscle fibers. So that's where that number comes from. Yeah, I know, it's a bunch of useless nonsense in this head. Sometimes anyways. Ah, okay, she has a deteriorating disc and have been getting shots in her back for more than 3 years. She has a pinched nerve too. Oh, okay. So I'm going to talk about her in a second. There's 2 videos. One's real crappy, but it's got good information. It's in my playlist. I think it's on lumbar spine or low back pain. It's called disc pain. So you can see that one. Depending on how old your mother is. Let's say your mother is in her 50s or older. She wants to look at the stenosis one, which is an older one that I have. Stenosis, lower back stenosis. Stenosis, stenosis. And that, what the heck is even that? I'm going to tell you in a second once I'm done with this piriformis. And so you want to stretch that piriformis a little bit. So the piriformis stretches this way. Now I want you to do this lying down, but just so you can actually see what the heck's going on. Just a gentle stretch, knee to the opposite shoulder if I'm stretching this side. And then to strengthen it, you're just going to lie on your side. You're going to do the clamshell. And I've shown the clamshell in a bunch of different videos because there's a lot of weakness that happens in your hip rotator muscles if you don't continue to strengthen them. And so when we go to stand and sit, a lot of that initial standing, our legs are apart. Our legs aren't collapsed together. And so these rotator muscles that rotate your legs outwards, which is that main one's your piriformis, has to stay engaged and stabilize and support everything else as we stand up and sit down. So that's the reason why you want to strengthen that too. And I have, like most of my hip and back videos, all have the piriformis clamshell in it. And I talk about where you want to make sure that you keep your pelvis locked and your back locked in place so that you're not rocking down on your lower back. So that's enough about the piriformis syndrome right now. I'm going to get little mini-me here because this thing is actually getting heavy. And so let's go ahead. Hi, Wanda. Let's go ahead and talk about Crazy's mother for a second. So let's say she has stenosis, all right? And what the heck does that word even mean? Stenosis essentially is just a narrowing of a canal. Now, you can have stenosis in your arteries and your veins. Think of it as a water hose, and if your water hose had rust, or a pipe had rust in the thing, and it had or calcium in the thing, and you could barely get the water through it, that is called stenosis. Just a fancy word is narrowing of a canal. And so if we talk about, so this is basically, if I pulled one of your spinal pieces out and blew it up, it would look like this. And so if we talk about what the heck is stenosis on a person, is this canal, it's this canal where the nerve comes out through. And as we age, or say we have the degenerative issue and our disc is flattened down, all right, and it doesn't pop up anymore because it stays flat, you can see the stresses on the back side of the joint. And so you can also see that this canal starts to get smaller if the disc is flat. If it's, you know, as you can see, this, as the disc inflates more and more, you got more room for this nerve. And so if she's got a disc that's kind of flat and she's got some arthritis in this joint, which we call the facet joint or Z joint or zygapophyseal joint, depending on who you're talking to, it's all the same thing. Now this joint right here I talked about last live stream, it's got a capsule. Basically it's in a cocoon, this joint is, and it's got cartilage on either side of the joint that helps it glide. And so that, like any cartilage, it can wear and get old like your knee joints or your shoulders or anything else do, and it can start to get some inflammation in it. And so let's say you have a flat disc because you have some degeneration there, you have some narrowing of the canal, and you have some arthritis in your facet joint. Yeah, you got yourself a problem because you're definitely getting a lot of impingement of the nerve. His lower back is out about 3 times a year. Well, he might want to look at my one video that I talked about. If you want to rewind this, or just look at my multifidus video that I did a week or 2 back. And that talks about when you get chronic straining of your back, how you can actually shrink the multifidus and you can actually get fatty deposits in the actual muscle belly itself. There's MRIs and everything to prove this, that actually fat deposits get in that muscle belly. And so you want to start at it now, because if you don't, all you're going to do is just wear down this joint even more. Or I should say on this one, you can see it wears this joint down even more. And we want to stretch, yes, but you can actually overstretch too. You want to definitely, everybody talks about this whole core and core stability. That's only a smidgen of the whole thing. All right. People always talk about strengthening the abdominal, strengthen this. You got to remember, you have all these back muscles. In one of my back videos, I think I have a few of them in there that talk about strengthening your lower back muscles and sitting appropriately. And when your back's killing you, stay away from sitting as much as possible. Lie on your stomach with 1 or 2 pillows. And so when you're lying on your stomach, to take that stress off that joint, it also makes all the muscles that line the backside of your pelvis and your back in a shortened position. You don't want those tissues to be over elongated that go from here to here. You want them to be in a shortened position. And so that takes the stress off the joint, as well as the muscle groups. And when you're lying on your stomach, you put 1 or 2 pillows so that your spine stays straight. If you're lying on your stomach and you don't have any pillows, you're going to overarch your back and you're going to irritate the joints. So that's one of the reasons why we don't want you sleeping on your stomach. It's good to make sure that you're doing both directions, bending forwards and extending your back. Your body loves movement. There's an old slogan out there, motion is lotion. What the heck does that mean, besides obviously the other term, derogatory in nature, is you want to make sure that these joints that we talk about here that have synovial fluid in them in a capsule, that you can continue lubricating them. Excuse me. Synovial fluid moves very well in and out of the joints when it's a non-compressive movement. That's why walk is very good. Static loading sitting, static standing is very bad for a back or hip problem because it squeezes out that synovial fluid out of the joint and it can't get back in. That's how your spine heals itself, is through synovial fluid. Takes the bad stuff out, brings the good stuff in, and gets that inflammatory process to calm down. She does have arthritis, yes. Anybody like me or older, I'm in, you could figure it out by now. The gray hair, the widow's peak, some of the wrinkles. I'm in my 40s. And so once you, I know, y'all thought I was older. Ha ha ha. Anyways, not tooting my own horn here, but anybody who is probably late 20s, early 30s, yes, you're going to have some arthritis. But be mindful that a lot of times, unless it's rheumatoid arthritis, the other kind is osteoarthritis, or there's also psoriatic arthritis. But let's just stick with the osteo, which is basically just normal aging. You don't have to have any problems with that. You can be what we call asymptomatic, which means you have no symptoms. You can have these diagnostic tests that show all these things, and that's not really where your symptoms are coming from. I talked about that in my last live stream. So yes, arthritis, when you're not dealing with an inflammatory active arthritis like rheumatoid arthritis or psoriatic arthritis, you'll be okay. Okay, let me just get a drink of water here for a second. Yes, she's in her 50s. Absolutely, that your legs can shake. Yes, because the nerves that I'm talking about are both sensory and motor. What the heck does that mean? Yes, that means that the nerve ending that's going from your back down into your leg and into your feet tell your the burning, the aching, the shooting pain, as well as the motor part, controlling all the muscles. That's how we can test certain muscle groups, and we know what nerve is involved, because every specific muscle in your body has a specific nerve that actually makes that muscle work. And so we have a good idea. Those are called dermatomes. Okay, and if you have a sensation issue, a certain part of your leg or whatever, and you have a numbness or burning in that certain part, we know what nerve is attached to that too. That's called myotomes. Wait, I said that backwards. Dermatomes are sensation and myotomes are muscle. Forgive me, everybody out there. So let's say that one more time. Myotomes are for muscles, dermatomes are for sensation, which basically means is wherever weakness that you're having or wherever burning sensation or pain that you're having, we know where that nerve is coming from, because it leads right to the spot. So yes, you can have some shaking in your legs if the nerve is really irritated. So be mindful of your mother. If she's in a recline chair or if she's doing a lot of sitting here, all right, just tell her to stay out of that. Recliner chair is the worst thing for you. Worst thing. Or sitting up in bed. Any type of letter C position is the worst thing for you. And it's going to be uncomfortable when you sit back, because those muscles are going to fatigue out very quick, because sitting like this, all my muscles are engaged. Then you're going to want to sag down in this position. That means that you're hanging on your ligaments and your bones instead of hanging on the muscles that support everything. All right, I think that kind of answered your question a little bit there. Anybody else have any questions before I move on? All right, I'm going to move on here for a second. So we're talking about the back and hip today. So we talked about the disc, we talked about the piriformis, we talked about muscle imbalance. You know, this QL muscle up here and this muscle in the front. This muscle, I didn't tell you what it was, but it's called your iliopsoas, or your hip flexor muscle. If you wanted to, whoops, I don't want my pelvis to fall apart here. But those play tug of war with one another. With one muscle group in the front, I'm going to kind of show it here on the side. That muscle literally runs the entire lumbar spine on either side, runs all the way down, and you have the other muscle group that attaches right in the pelvis. And those two muscle groups kind of come together. I wish I had a third hand. They come together and they kind of come and attach like that. So when you move your leg up and down, it moves your leg up and down. Or if your leg is straight, it moves your back forwards. And so it's a huge muscle group. And that other muscle group in the back, I talk about it, basically attaches kind of like this on your ribs. So your ribs would come out like this and attaches to your, what we call your transverse processes, these bones out to the side, attaches to those in the top of the hip. And so if you're doing a lot of sitting, you're going to over elongate that muscle group and it can get irritated. I didn't get into a lot of what we call active or latent trigger points last time because it was towards the end. But if you've ever heard that before, like you can get it in your neck, like I got one in mine right now. You can get them in your lower back. Now there's two types. There's active and latent. And the broad category of them, it's called central and satellite. So you have the central and the satellite trigger points. You know, the central ones that are the real, you know, you touch on it and it shoots you. And then you can touch down the back side and you can kind of feel it there. Those are kind of like the satellite ones that aren't active. And so you can have latent ones that are just kind of tight and tender. And then the active ones where they're kind of shooting down, shooting up your back or in your neck or something like that. So there's two types of trigger points. And I've gone over a lot of my different videos talks about, you know, the Theracane, the TENS unit, tennis ball, try and bring blood flow into those areas because that's what you want to do. My last video of neck tightness, I talk about basically, yeah, I have it at 30 seconds. I'm going to next time make it no delay at all. I apologize for that. Hi, Joanna. Thank you for coming. Are those shots bad? That's a good question. I'm not sure that it's a bad or good thing. I think it depends on what the doctor's trying to do. If the doctor's just trying to reduce the pain down the leg and do one or two of them and get you on your merry way and keep you managing your symptoms, that's a good thing. But if it's a steroid injection, which most of those are, that you're talking about, those epidural injections or spinal injections, there's a sequence of them. You only can get them every so often. And the reason for that is because a steroid doesn't know the difference between healthy tissue and damaged tissue. And it will weaken everything over time if you keep injecting that area. So they want to make sure that you have a nice space time between each injection. You really need to find out, you know, like I talk about here, what's keeping your mother, her back symptoms aggravated. You know, if she's had spinal surgery or something like that, that might be a whole other bag of tricks that we'd have to talk about. But let's just say she didn't have any back surgery. We need to really find out why she continues to still have back problems. And if it's some of the stuff that I'm talking about that she's doing, she's got to quit doing it. Otherwise, she's going to keep having those problems. But yeah, any steroid over time, the doctor is not going to want to keep hitting that area because it will weaken the structures around it, the ligaments, the tendons, and the muscles, and then will make you more apt to get injured even further next time. So yes, prolonged steroids, whether you're getting a shot or whether you're taking steroids in through your mouth, are not good. I mean, they can give you osteoporosis. They can give you, just you can all type in just steroids and the side effects of steroids. You can have what's called Cushing's disorder or Cushing's disease. So there's, you can just Google it and you'll find out all the kinds of scary things you can have if you do steroids long term consistently. So over time, yeah, it's bad. Short term, no, not so much. Thank you, Happy Vlogs, for coming. So what happened to my All right, I'm back. Sorry about that. There must have been something happened. I lost the signal for a second. I totally apologize if you. Hopefully I'm back. I think I'm solid now. All right. Okay, good. It's fine again. Sorry about that, folks. All right. So, any questions at all? Let me think. I lost my train of thought. Oh, I was talking about steroids and how they're not really the best thing for you long term. Short term, yes. Long term, not so good. That's the reason why when you see a primary care doctor and they put you on steroids, they might put you, this is oral steroids in this case, they might put you on a 5-day or no longer than a 10-day pack of steroids because anything prolonged is it's tough on the kidneys, it's tough on the liver. You're talking steroids is a hormone. And so it can start to affect your hormones over time. That's why people can get angry. And there's two types of steroids no one's ever talked about. You got the Arnold Schwarzenegger, all right? And you have the, what our wonderful other crazy was talking about that his mother gets are the ones that break the tissue down. So we have anabolic steroids, is what Arnold Schwarzenegger took, allegedly. And then you have what the medical profession does to reduce inflammation. It's called catabolic steroids, which is it shuts down the inflammatory process. It's kind of like what ibuprofen and Advil and all these other medications, tramadol, that's a prescription based and stuff like that. What they do, they slow down the inflammatory process a little bit. Steroids shut that baby down. Boom. but you get a lot of side effects involved with it because it affects your hormones. You're up a lot more. You can be more, jittery, or you could have an appetite that's like for an elephant. So short term, yes. Long term, bad. So I think that's probably killing the dead horse with that, but that's at least enough regarding that. Foxfire. Um, let's see here. Anti-inflammatory meds like Cataflam, docs keep on prescribing for those for me, and I don't want to take them anymore. Got to use to them, just numbing the pain. Yeah, you got to kind of tell me what's going on with that Foxfire. Yeah, anti-inflammatories are technically they're if your pain's coming from an inflammatory response, then yes, all it's really doing is shutting down that inflammatory process, and then obviously your pain calms down. So you have to look at why you're having that pain in the first place, or why that inflammatory process keeps going. Now, if it's in your lower back, it could be some of the stuff that I'm talking about that you have to kind of unfortunately start to change how you do things to hopefully keep that inflammatory process down so you can stop taking the medication. Obviously, whatever your doctor prescribed to you, I mean, I'm not a physician. I would say, I don't know your history. I don't know nothing about you. I'd say that doctor's probably doing the best thing they possibly can for you. I'm trying to give you guys some ideas and some techniques that hopefully you haven't been doing, that you can start doing, that will actually help some of your symptoms. Hopefully that answers your question. So, I guess it's just me here left as far as I can tell. I'm going to stay a few more minutes, and if I get anybody, great. If I don't, I understand too. You guys can go ahead and watch this afterwards if you want to. So the last thing I want to talk about when it comes to the back and the hip is, let's say you think that you just injured yourself, right? And you're having these back and hip symptoms for a while, and you're just trying to self-treat. That can be a bad thing, because you want to at least have an x-ray by a primary care if this has been going on for a while, just to make sure that there's nothing else scary going on there, that you might, if you have some sort of osteoporosis, that you might have a fracture that you don't know about. God forbid you have cancer in this area that you don't know about. God forbid that you have something like a neurological problem going on, like MS. All right. And so those types of presentations can look like an orthopedic problem sometimes, and they're really not. So be mindful of it. This has been going on for quite a while and you haven't seen anybody. It's probably time to go at least see someone, and maybe at least get an x-ray, just to kind of clear out the obvious things, the scary things. And so, but on that note, oh, I got 4 back here. Oh, I guess I'll keep going. Thank you for coming back. But like I was saying, I had a friend years ago, and they had numbness down in their leg, and it presented like a sciatica problem, and they were going to a chiropractor for quite a while, and they weren't getting any better. So they went and finally had an x-ray done, and the doctor was kind of scratching their head. So they went and had an MRI done on the lower back. Come to find out, they had a neurological problem. They could see on the spine, they had plaques, and that's one of those things for MS, that you can it might look like an orthopedic problem and it's not. So you better make sure, if you haven't seen some doctor and you've just been kind of playing doctor yourself with over the prescription medications, and the new thing out in the market is lidocaine. Everything's got lidocaine in it nowadays. You're kind of doing the whole lidocaine numbing pain thing. You got to make sure that it is just an orthopedic problem. There's nothing else going on there. So, any other questions so far? So is there anything you guys want me to talk about for Wednesday? Because I think I'm gonna make Wednesdays my live stream days. I'm gonna throw that up on my channel in a little bit. I'm gonna change my banner a little bit to say Wednesdays live stream, and then Saturdays I'm gonna do my little videos that I do. And so what do you guys think about for next live stream? Oh yes, good old restless leg syndrome. Yeah, that's one of those. That's one of those terms out there that I call it the I don't know what the heck's going on. It's usually a diagnosis of exclusion, which essentially means that they've kind of ruled everything out, and the only thing that's left is restless leg syndrome. And so a lot of times it could be an undiagnosed back issue or an undiagnosed, sciatica symptom, and it's making your legs really achy, burny, or just want to move them all the time because it helps the pain level. And so, yeah, I mean, it's one of those things where you can go to a lot of doctors before you actually figure out what the heck's going on with your legs, because it's kind of like I call the runny nose syndrome. A lot of things cause a runny nose. A lot of things cause leg symptoms. And so it's why it's really nice when you go to your doctor that you give them as much information as you possibly can. I always tell people to write down all the information, because when you see the doctor, they're like the Tasmanian devil. They come in, they're back out, and you're like, well, I didn't answer. You didn't answer after my question. So it's always to go there with a sheet of paper with questions on it. That way you don't forget to ask any questions. So sometimes it's hard to pin down those doctors. Oh, okay. Shoulder pain and neck. That's a good idea, and I think my next purchase, I'm gonna get a shoulder model. Maybe I'll look into that tonight. Maybe I can find one, and then by Wednesday maybe I'll have it. So, yeah, I think shoulder and neck. I mean, a lot of people are having the classic cases. I could talk about the knee or the ankle and the foot, because I know I got a model on the ankle and foot here. People like to talk about the plantar fasciitis and stuff, but yeah, I can talk. There's tons of live streams I can do just on shoulders. The different types of surgeries, the different type of symptoms that might not be a shoulder, that's coming from the neck, or it might be coming from the mid-back and not from the shoulder. And so the shoulder's pretty tricky, that floating joint, and it can throw a lot of people off if you don't sit down and listen to the patient or client to really figure out what's going on. Yeah, thank you, Fox, for dropping a thank you or a thumbs. Yeah, I got three thumbs up out of, I don't know, 8 or 10 people that showed up. So that's better than 8 or 9 thumbs down. I mean, a chiropractor, yes. I mean, the problem with if your problem, your lower back problem, Wanda, is a stenosis or an inflammatory process going on, having a spinal manipulation is not going to help. It's probably going to increase that inflammatory process more. But if you're having a lot of just like lower back stiffness and no leg symptoms, you'd want to go to a chiropractor that also has a masseuse or a massage therapist there too. They're doing a lot of back tandem ones where you have the chiropractor does their thing, and then they'll have the masseuse in there at the same time. And so if you can get the masseuse in there maybe loosen up some of those back muscles, and then get the chiropractor to do an adjustment. That's the thing you could get away with if you're just dealing with some joint stiffness and tightness. But if you're dealing with something that's radiating down into the butt area or in the leg, chiropractor, if they do a manipulation, they're just going to cascade inflammation and get that thing inflamed even more. They're going to end up doing E-stim and ice on your back and charging you $100 for it. And I've shown, my last video on the neck, I put a link in there for a TENS unit that you can pick up for probably 15 bucks, and have buy a carton of 9-volt batteries, and there you go. You've bought a TENS unit for the rest of your life. It's no different than what that chiropractor or the physical therapist is going to do in the clinic if they're just doing a TENS unit that's based on pain management. Now you can do a TENS unit for a lot of different things: muscle contractions, reducing muscle stimulation, all kinds of stuff. But if you're talking about a TENS unit just for pain relief, yeah, you could do that. TENS unit with ice in your lower back could probably help you. I'd probably try that before a chiropractor, and just try changing how you're sitting and stuff and see if that helps your symptoms. Oh, thanks, Foxfire. That's a beautiful thing. Hi, Just Me 64. Oh, you came. She's one of my new subscribers, new friends, part of the family members, however you want to describe it. I saw her, I think, this morning, and she's coming to my live. That's very nice of you. Yeah, the treadmill, what you want to do is make sure you're at a 1% grade on your treadmill. And the reason why you want to be at a 1% grade on your treadmill, because it'll take some of the impact out of the back and the legs. And so that 1% incline, don't go any higher than that, because the higher you go on a treadmill, the more your back extends. And if you have any arthritis in that lower back, if you overextend that lower back, you'll irritate it more. And so, but if you're just doing a 1% incline, that's just enough give to that area that unless you have a fancy treadmill. They have some new ones out there that do decline, and they have the shock absorbers on them. But just a basic run-of-the-mill treadmill that you have at your house or you have at the gymnasium, go to the gym or whatever, they're just a basic treadmill, and you want to be at about a 1% incline, and that will also reduce some of the lower lumbar stress. Now the bike isn't too bad either. If you have one that just has a little seat, that can cause a lot of this at your lower back. All right. If you have one that has a back on it, like a recumbent bike, you'll be better off. And you want to stick back in that seat when you're on that bike. But if you don't have a back to that bike, be mindful of this. When you get off of the bike, if you have one that doesn't have a back to it, your bike, if it doesn't have a back to it, when you're done, you want to go on your stomach, all right, for a good 5 or 10 minutes so that your spine gets used to being back in the opposite direction, because you were too long in a flex position, and that will stress your lower spine too. That'll irritate the snot out of it. And so be mindful of that too, that our bodies, our spines like to be in both directions, and we're usually too much into a letter C or flex position. Hey, Shadrach. Hey, brother. I'm going to see one. I watched one of your videos yesterday. I think I'm going to watch another one of those videos. He does all the video games, and it's kind of cool to see the old video games as well as the new ones on some of my subscribers that I watch. It brings back the memories when I was a kid. I go back. I go way back. I go back to I remember not only Atari, but I remember Pong. I remember Tank, when I was a little kid. And so it wasn't until Nintendo came around, or NES as you used to call it, Nintendo Entertainment System, with the little Gyro the robot, was Nintendo's first gig at it before they came out with the gun, the Duck Hunt. So the first system NES came out with was with the robot, and it didn't do too well. That probably 4 months later they came out with Duck Hunt and came out with a gun, and that's what they started to sell. So yeah, I love watching your stuff. You're welcome, Wanda. Hope that gives you guys some information. So, yeah, my next live stream, I think I'll do probably shoulder and neck, or maybe just shoulder or neck. I mean, that's a lot of information in one live stream. I'll probably just do one basic type of shoulder problem that people can have, and then maybe I'll do focus one specifically just on the neck and shoulder. I have a couple videos on what's called the levator scapula, and that muscle actually attaches at the shoulder and the neck area. And I did a video maybe last week or the week before then. It's got the actual skin, or the thumbnail is I have the muscle group in the color green, and so that's a good one if you're having neck and shoulder problems. A lot of times is that stupid levator scapula, and so you could look at that one if you wanted to. In the meantime, they give you some hints before I do a live stream on that. But I think this next one I'll probably just get a model of the shoulder in what we call the shoulder girdle complex. Okay, that's what the heck is that? Yeah, stay tuned on Wednesday. That's probably what my next one's going to be on. So yeah, I was well, now that I'm in my 40s, I YouTube sucks up the rest of my time, which I don't mind, I really don't. I mean, anytime I play games now is usually on my phone, and I don't have the time. Or, I mean, I could make the time, but I always like to use it to try and make this content better and make my videos better. And so I continue to do that, and that takes, as you guys know, being creators, if you want to get better, whether you're making your graphics better, or your sound better, or the color of the video better, it takes time and a lot of work. Everybody else that isn't in the creator fold, so to speak, don't have a clue how hard it is to make this stuff and make it good enough. So shout out to all my creators when it comes to that. So do you guys have any more questions on the back and hip? Don't forget to put a thumbs up. I got 6 subscribers here, or 4 of them here, or whatever. Don't forget to hit the blue bell, hit arrows up if you would love it. I'd appreciate it. I don't know what the heck that does with YouTube, but hopefully they won't, cut me off if I get a bunch of down arrows. I think the last thing I'm going to talk about here before I call it is just the hip. And there's a lot of stuff I can talk about in the hip. I'll probably, at some point, I'm sure I'll do a whole video just on the hip. And so if we look at the hip, and I take it apart here for a second, this is what's nice about this. Is a fairly expensive model, and I did that because this does a lot of stuff. And so, oh, thank you, Flippin', for coming. Yeah, we sit too much. Yeah, exactly. All right, so the last thing we'll talk about is the hip here for a second. And so if people remember Bo Jackson, back in the day, Bo knows this, Bo knows that. All right, so he was a baseball player, and he also played football, professional. That's right. Guy was a freaking rock star. This is long before anybody else came out. All right, was Bo Jackson. And so he had avascular necrosis. What the heck is that? That's basically where the blood flow of your ball, of your femur, is gone, or it's gone. So this little string, we're going to say, represents the artery. It's really only one artery, and as crazy as it is, this one artery that goes from the ball to the socket. And when that gets disrupted, this ball dies. That's called AVN. Avascular necrosis. Necrosis like something dying? Yes, it dies. And you have to have a hip replacement. Now, I'm going to do a bunch of stuff on hip replacements and knee replacements if you want me to down the road. Those are easy. Shoulder replacements. All types of surgeries. So we can go over that down some videos down the road, some live streams too. But when that's the big issue is if you're having some pain in that hip, that's an easy thing to find out on an X-ray, whether it's just some arthritis or whether you have something scary like avascular necrosis. Now you can get that at any age. I mean, you can be in your 20s on up and have avascular necrosis, having hip pain, and until they do an X-ray, you're not going to know. And so these people, these kids who think they're invincible, like I thought I was, and I'm sure everybody else here thought they were when they were young. Oh, it's not bad. It could be. It could be something as scary as that. And so that can be very traumatizing because that is immediate surgery. There's no fixing that. You're going to have a hip replacement because that ball has died or is in the process of dying. And as it dies, you'll start to have fractures of the ball. It'll start to fragment and break apart. And so that's AVN, avascular necrosis. And so that being said, this is my second live stream. And I want to thank you all for coming. All you beautiful people that took a little bit of your Saturday, Sunday, or Monday, wherever in the world that I'm talking about, that come and see and listen to me for a little bit. So Wednesday, I'm going to be bringing a live stream. I think I'm going to bring it on the shoulder girdle complex and some basic stuff on that. So I'm going to try and do it about 6 or 6:30 Eastern Standard Time. And so go ahead and look for that. But until next time, Scully and I want you to look up and keep smiling. See you next time, folks.